To talk about cancer-related fatigue. It's a topic that's very near and dear to my heart and something that I've been studying for over 10 years, so I've read the literature. Okay, so in my talk I'm going to give you some background information about fatigue, and I've been asked to talk about the research evidence that supports the interventions that we'll talk about and the evidence-based guidelines that are available to help practitioners and patients. And then I really want to focus on some strategies to help you manage your fatigue. And so I'm going to call this energy balance strategies because there are a number of strategies and we're going to focus on those. And then I'll talk a bit about some resources that might be available to help you. So I have been teaching at Queen's University for over 10 years now, and I've been involved in research for over 10 years as well. And my very first research study that I was involved in was called Health and Wellbeing in Older Persons with Cancer. And that's me standing beside my very first research poster. So all of my clinical research has been focused on cancer and the cancer survivorship period, and some specific focus on cancer fatigue. It's always a good idea for a speaker to know who their audience is. If you don't mind sharing, I'd like you to raise your hand just so I can get an idea of how many of you are currently cancer patients undergoing treatment. Okay, and how many of you have finished your treatment? Most of you are finished. And how many of you are family members or friends of cancer patients? A few. And any healthcare professionals? I've got a few as well. Okay, good. So we've got a mix of people, and all of us are concerned about cancer-related fatigue and how it affects those that are experiencing it. I just want to tell you why I am so interested in cancer fatigue. So when I was involved in this first study, I was a research assistant doing my master's. I was sending out surveys to older persons with cancer. We were following them for a year and seeing how they were doing. They were phoning me up because my phone number was on the front of the survey, and they were asking me for advice. And they were telling me that their cancer treatment was over and they're still having a number of problems. And one of the things I kept hearing about is that they were having fatigue, and nobody knew what to do about it. Their physicians didn't know, nobody was giving them any advice. So that bothered me. Second thing that happened also while I was doing my master's, I had to do a clinical placement. And so I chose to do it in the Cancer Center in Kingston, along with an advanced practice nurse who was running the cancer fatigue clinic that no longer exists in Kingston. And so I had the opportunity to speak to some cancer patients about their fatigue and ask them what it was like. And I remember one lady in particular because she said to me, you know, every day it feels like I've been run over by a truck. Some days it's a pickup truck, some days it's a semi-truck. And that really resonated with me. And I also have a best friend who's exactly 5 days older than me, who was diagnosed with breast cancer 5 years ago. And I've seen her go through her treatment, and she's doing well, but she's still not the same. She still doesn't have the same energy level that she had prior to her cancer diagnosis. And we live far apart, so we only see each other a few times a year. And when I used to visit her, we would stay up half the night talking to get in as much time together as possible. And now when I go to visit her, she usually has to go to bed by about 9 or 10. So I can see the effect that her fatigue has had on her life. So those are just some of the reasons why I'm very passionate about cancer fatigue. So I've been involved in a number of studies, and I mentioned one. The study in the middle is my master's thesis. Fatigue, physical activity, physical function, and quality of life in older persons with cancer. And I was using data from one of the other studies, but I really wanted to focus on fatigue because it was something that at that time wasn't in the forefront. It wasn't something that was being discussed a lot. And as my patients were telling me, nobody was addressing it. And so my research showed a few things. It did show that patients, their most prevalent symptom was fatigue. And it also showed that there was a relationship between their fatigue and their physical activity level. The patients that had the highest physical activity levels when they first came to the cancer clinic had lower levels of fatigue later on during that course of that year. So we'll talk a bit more about physical activity later. My current research is building on that. So one of the problems with fatigue and cancer survivorship is that in the primary care setting, sometimes the physicians and nurse practitioners don't know what to do about some of the problems that cancer survivors continue to experience. And something that's happening in Ontario now is that cancer survivors are being discharged earlier to primary care follow-up. So for example, breast cancer survivors or breast cancer patients were followed for about 5 years in the cancer clinic. And now they're going to be discharged at about 2 years post-diagnosis if they're doing well. And then the primary care provider will be following them. So I'm interested in knowing, are these primary care providers ready to assume that responsibility? Do they know about the guidelines? Do they know about the evidence? And are they currently already implementing those types of guidelines? And so I'll just tell you briefly that one of the things I was asking them about was whether or not they screened their patients for fatigue and whether or not they were recommending physical activity for their patients. And in a nutshell, less than 50% were doing so. So that means over 50% did not know that they should be doing these things. So this is something, in addition to educating cancer patients and survivors, I want to focus on helping the providers to learn more about what they should be doing so that they can also help you with your fatigue. So we'll talk a little bit about some background information about cancer fatigue. So as I'm sure most of you in the room who have experienced it know, cancer-related fatigue is not the same as usual fatigue. It's very different. And sometimes it's hard to articulate that to the people around you. They don't understand. Okay? So we're going to go over that a little bit, and hopefully it'll make it easier for you to explain to others what you're actually going through. So while I've been studying cancer fatigue, the definition of cancer fatigue has evolved, because at first it was very poorly understood. And so this is one of the more recent definitions by the National Comprehensive Cancer Network. And it's a definition that captures a lot of those elements of cancer fatigue that make it different from usual fatigue. So I've actually bulleted the points rather than having a run-on sentence as it would normally be portrayed. So first of all, it's distressing and persistent. So as I said, a cancer patient can experience fatigue for years after their treatment has ended. But even while they're going through their treatment, the fatigue is unrelenting. Okay, so it's not like it's one day of the week. It's usually every day of the week they're experiencing this intense fatigue. And that's distressing because it's interfering with their life. Fatigue is subjective. And one thing about cancer fatigue is it doesn't just give you a physical sense of fatigue. It also gives you a cognitive and emotional sense of fatigue. It affects your whole body, your whole being. As well, the fatigue is not proportional to your activity level. You can be sitting around all day doing nothing and you're exhausted as though you've worked 12 hours on a chain gang or something. You're totally exhausted. And finally, the distressing part is how it interferes with your usual functioning. So it interferes with your physical function, your social function, etc. So it really interferes with your whole life. And why is cancer-related fatigue so significant? It is actually the most common symptom that cancer patients report, and it is across the board for all different types of cancer. Some cancers patients experience it more because of the types of treatment they're having, but across the board, across treatments, patients experience fatigue. Patients also report it's most distressing. It's more distressing than cancer pain. Physicians will address their pain, they will do something about it, but the fatigue is left untreated. And it's the most debilitating symptom as patients report it. And if you read all the research reports, you'll get different numbers, but the numbers range up to 100% of patients experience cancer fatigue at some point during their treatment or afterwards. The other thing that's significant about it is, I think when you're diagnosed with cancer, I think you can accept that you may have to give up a year of your life to go through treatment, and that, yeah, you're not going to be feeling too well. But then when you realize that the treatment's over and you're still experiencing problems like fatigue, patients aren't expecting that, their family members aren't expecting that, their boss isn't expecting that. So that is a problem. So you have to address the expectations of yourself and everyone around you that it might take you a little longer to get back to your usual level of functioning. And as the research says, in some patients, that fatigue can persist for years. So most patients will take another year after their treatment to kind of get back to usual activities. Other patients will take 5 years, and there's a few patients, again, that will take longer than that, or they may never go back to feeling like they have a usual level of energy. Some of the patients that I talked to, the most important thing to them was that people acknowledged that it existed, that it wasn't all in their head, they weren't faking it, that they truly did have this intense fatigue that was making them not able to do the things that they wanted to do or the things that people were expecting them to be able to do. So over the years, we've been looking at what causes fatigue, and there's a lot of underlying mechanisms that we still don't understand, but we have been able to identify some of the factors that contribute to fatigue and make it worse in cancer patients. So the cancer itself and the cancer treatment, we can't do a lot about that because you want to have the treatment so that you can cure the cancer. But some of these other things we can address. So these contributing factors are things that we are going to talk about in terms of self-management and in terms of things that you can discuss with your physician that need to be addressed to try to get your fatigue under control. So why self-management? Why doesn't the physician, the nurse practitioner, take care of this for you? So if you think of cancer as a chronic condition as opposed to an acute condition where you're treated and it's over, it lasts a number of years, those lingering symptoms. We know from research with other types of chronic conditions like diabetes or heart failure, if the patient is involved in managing that condition, they actually have better outcomes. So they have better physical outcomes, they have better emotional outcomes. And one of the reasons for that is it helps to give you back a sense of control over your life. So cancer takes that away from you, the treatment, but if you're involved in the day-to-day management of your condition, it helps you to be under control again. So we'll talk a little bit about the research related to cancer-related fatigue. And I just wanted to give you a historical perspective. The very first published report on cancer fatigue was not published until 1979. So that means that the research on cancer fatigue is relatively new compared to other topics like cancer pain, etc. Okay? So initially, researchers were focused on finding cures or treatments for cancer, and it wasn't until we started having really good treatments and patients were living longer and we realized that patients had some symptoms that were ongoing, that researchers started to focus on things like cancer fatigue. And again, they were trying to understand what it was, what was causing it, and they weren't focusing a lot on what they could do about it because they didn't understand what was causing it. The very first guidelines on cancer-related fatigue were not published until 2000, so that's only 14 years ago. And so those guidelines were the first time that someone had pulled all the evidence together to give practitioners and patients some idea of what they could do about cancer-related fatigue. And we were talking about this over dinner today, but research evidence takes about 20 years to go from research to practice. And a guideline is one of the ways to help get that research evidence into practice. So if those guidelines were published 14 years ago, we still haven't reached the 20-year mark yet, and I can vouch that practitioners are still not aware that these guidelines even exist. And they're available online, free of charge, to anyone that cares to use them. One of the few interventions that were published in the first guidelines that were effective was physical activity. And so in the 2000s, we saw an explosion of research about physical activity for cancer patients, for physical activity during treatment, physical activity after treatment on different types of patients. And a lot of the research was done with breast cancer. Breast cancer patients often will have higher degrees of fatigue, so there was a concentration on that. The other thing that research looked at was asking patients to describe their fatigue. They were trying to get a handle on what was really going on. And so in addition to having feelings of tiredness, patients were describing having lack of motivation, lack of concentration. So that's that cognitive aspect of the fatigue. And having sadness, so the emotional impact of the fatigue. And so a lot of the research was describing the patient experience of fatigue. As well as the actual symptom experience of the patient, the research looked at what were the consequences of the fact that we weren't able to manage the fatigue adequately. And so a lot of the outcomes that were published over and over again in the research related to reductions in physical function. And that was one of the topics that I looked at in my master's, and definitely was something that was related to higher levels of fatigue. Patients also experience loss of productivity and self-esteem because they're not able to fulfill their normal roles that they would carry out day to day. They cut back on their social activities. So again, that's a negative consequence. And another thing they were finding was that the main reason that patients often discontinued treatment or had to have their treatment altered was because of the high levels of fatigue that they were experiencing. As well, if we're studying fatigue, researchers needed ways to measure fatigue so they could quantify it. And so a whole bunch of tools were developed to measure fatigue. And so you may have participated in a study at some point measuring fatigue, and they may have asked you to fill out one of these questionnaires. I don't know, does anybody recognize any of these? Have you filled out these types of questionnaires? No? Okay. The problem with these, though, is that they're long and they're tiring, and they're not, they don't have useful clinical applications particularly. So one of the tools for measuring fatigue is a simple 0 to 10 scale where you measure or you rate your own fatigue level. And that can be found on the Edmonton Symptom Assessment System, which is often used in cancer centers as a quick way to get an idea of how the patient is doing in terms of fatigue. It's simply a screening tool, and then depending on where the patient lies in that continuum, it may prompt that the patient would have a referral to have some further assessment done of their fatigue. This is something recently that I actually like quite a lot, because sometimes people have trouble putting a number on their fatigue. But if you look at the pictures, you can probably figure out where you fit in a little more easily. So the recommendations that were coming out of the research, that if a patient had mild fatigue, which would be rated 1 to 3, we should still be providing them with some education about some self-management ideas, and that we should rescreen them periodically to make sure that it wasn't increasing or causing problems. However, patients with moderate to severe levels of fatigue, they did need to have, it is recommended that they would have a full assessment of their fatigue and some ongoing interventions. With the earliest recommendations, there were 3 interventions that were suggested would be helpful for managing fatigue. So the first one was to manage the underlying causes. So I showed you the diagram that showed pain and other things. So if the physicians could help the patient to manage all of those conditions, then that would help alleviate their fatigue. The second intervention was to help patients to restore their energy balance. And that is the matter of balancing your rest and your exercise. And so there was a lot of research, as I said, on exercise. And then the third intervention suggested was to help patients to restructure their expectations, to be more realistic about what they could accomplish during their treatment and afterwards. So those were the early guidelines of what should be done. I'm going to talk a bit about the research on physical activity, since it was the focus of a lot of the research, and it is the most highly recommended intervention for fatigue. So one thing researchers noticed was that cancer patients tended to decrease their physical activity levels at diagnosis and during treatment. And it was because, first of all, there was the stress of the diagnosis. There was the fact that they were going to treatments or lots of appointments that was taking time away from being able to be physically active. And one of the most important reasons was the fatigue itself. And it was intuitive. I'm very tired, so I'm going to rest. And the physicians, oncologists, and well-meaning people were telling patients they needed to rest. And unfortunately, after their physical activity levels declined, they weren't able to get back to regular activity following their treatment as well. So that's a problem. Not surprisingly, many cancer patients were not meeting the current physical activity recommendations. It's not surprising because actually most Canadians are not meeting the physical activity guidelines either. So to have someone with extreme fatigue to be trying to meet those guidelines is a little unrealistic. I mentioned sometimes clinicians were actually telling patients to rest. And they didn't realize at the time, and many still do not realize, that it's actually the worst thing, the worst advice they can give patients. Okay? So certainly there are some days when you absolutely cannot do anything, and you have no energy, and you cannot do any activity, but there needs to be some day-to-day activity so that patients can maintain some level of energy and be able to gradually improve. So if patients are inactive, they are going to become less physically fit, they're going to develop physical functioning decline, and that's going to make them more tired, which is going to make it more difficult to exercise, and they get caught in this downward spiral that's difficult to get out of. So a lot of research was happening over these years, and then in order to make sense of all the research and to come to some conclusions, some researchers focused on pulling together a number of studies in what we call a systematic review. So they would look at all the physical activity studies that had been done over a 10-year period, for example, and see what the overall result was. So some of the overall results they were finding was that physical activity is safe during and after cancer treatment. And that was another reason why cancer patients are sometimes hesitant to be active, is they don't know if it's safe, if they've had surgery or something, so they need some advice about whether they can continue to be active. And there was lots of evidence that being physically active would help to decrease fatigue. And we were seeing that over and over again, regardless of what type of cancer it was and regardless of what type of physical activity was being done, whether it was walking or swimming or biking. So any activity was helpful. And as well, it helped to improve physical function and improve quality of life in these patients. In 2010, there was a Cochrane review published. So Cochrane is an organization that publishes very high-level systematic reviews. So they tend to use only the best studies, the randomized controlled trials, which give you the highest level of evidence that a treatment is effective. And so this Cochrane review pooled results from 28 studies, from 28 randomized controlled trials. They found that exercise was beneficial to reduce cancer fatigue during and after treatment. What they also reported was that the studies didn't really give us a lot of guidance on what was the best type of exercise and what was the best intensity and timing of exercise. But what it did show was that exercise of any kind did have some benefit. Great, so we now have a body of research on cancer-related fatigue and physical activity in particular. We still need to get that evidence to the people that are giving advice to patients. And so that's where evidence-based guidelines come into play. So I mentioned that the National Comprehensive Cancer Network first published guidelines in 2000. And since then, they've been updating them. So every year they review the new evidence that's coming in, and they change recommendations if anything has changed. As I said, those guidelines are available online, but still practitioners are not accessing them. Patients can access them as well if they would like. They're free. We also have some Canadian guidelines that have been developed, and they actually looked at some of the NCCN guidelines as part of their guideline. So a group of experts in Canada reviewed other guidelines and agreed or disagreed with the various recommendations and published a guideline here in Canada. So there's a number of these guidelines floating around now that are available to help guide practice. And so now we have 5 categories of interventions that have been identified in the research as having some helpful element to them in helping patients deal with cancer-related fatigue. And I'm going to talk about each of them separately. So I've already mentioned this, treat the contributing factors. It seems like a no-brainer, but make sure that if you're going in to see your physician about your fatigue, that you talk about some of these issues if you're experiencing them. So pain can be managed. Depression and anxiety, that you might need a referral or you might need some medication to help you get through a bad period. But again, there is help that can manage that aspect that is contributing to your fatigue. I'm not going to talk about nutritional deficit, but that is something, again, that can be assessed and will help you to regain some of your energy. Anemia is one of the easy ones. There is a direct cause and effect between anemia and fatigue, and again, it can be treated. Sometimes, probably lots of the time when you're a cancer patient, you're taking a number of medications, medications for treatment, medications to manage the side effects, and when you put all those medications together, you compound the effects. So sometimes having someone review your medications and seeing maybe if you can come off some of them, it might also help your fatigue. And comorbidities. So if you go into your cancer diagnosis and you already have heart disease or diabetes or lung disease, sometimes those areas get overlooked by the cancer. So you put off your other appointments because you want to get the cancer under control. But if those other problems are not well controlled, you're going to have other symptoms. So if you have lung disease, that can make you tired. If you have heart disease, that can make you tired. So make sure that you're addressing any other medical issues that you have while you're on treatment and afterwards as well. Psychosocial interventions. So there's actually good evidence that cognitive behavioral therapy, psychoeducational therapies, group therapies are helpful to managing cancer fatigue. And you might need a referral from your family physician or from the oncologist to be able to access these services. And ideally you want to participate in a group or individual counseling that is run by someone who has some knowledge about cancer and specifically about cancer fatigue. There might be some resources you can access online as well. This is just one that I came across, but there will be others. If you look at the Cancer Society and the American Cancer Society, they do have resources that help, again, help you think about and reframe, and that will be helpful to your reducing your stress, which indirectly will help you sleep and help you with your fatigue. There's also mind-body interventions. The evidence isn't as strong for these categories, but there is some evidence. Definitely meditation, mindfulness-based approaches are helpful, and yoga in particular. And you'll often see that there will be yoga programs organized for cancer survivors where cancer survivors can go together, and ideally, again, led by someone who is familiar with cancer and can help to adapt perhaps some of the positions and activities that you're doing, and acupuncture. Some of the other healing, touch, relaxation, all of those things, intuitively we would expect that they would be helpful. Again, they're not well researched. Anything that makes you feel good, that makes you feel like you're in control, that you're getting your stress under control, again, will help you sleep better and will help you to boost your energy level and hopefully relieve some of that fatigue. I just wanted to mention neurofeedback. I just happened to read a study about it about a year ago that said that there was one study with breast cancer patients where they used neurofeedback, and it helped their fatigue and it helped their cognitive impairment, or chemo brain. And so I got all excited because, again, I'm always looking for things that will help. And I did a systematic review that's not published yet. There was only the one study, so I can't recommend it. But again, it's one of those things that if you feel that it might work, you can try it. And I'd certainly be interested in hearing from anybody that has tried it, whether it worked or didn't work, to see what your experiences was. Because I would like to actually do a little bit more research in that particular area. Pharmacologic. So right off the bat, there is no magic pill that is going to help your fatigue, okay? There are some medications that are helpful in certain circumstances. Most of these medications, so EPO would be appropriate if you were having anemia, but the other medications, They are mostly helpful for patients during treatment with very high levels of fatigue. They're a little bit helpful, or patients with advanced cancer. They are not helpful for patients with usual moderate levels of fatigue, or after treatment they don't find any effect from these. So this is kind of a last resort, something on a one-on-one basis with your physician. Obviously, if you're experiencing depression, an antidepressant would be helpful. But for the general population, medication is typically not the way to go. So the first cancer-specific physical activity guidelines were published 2010. So that's only 4 years ago. American College of Sports Medicine, again, looked at all the research and came up with some guidelines. And then the American Cancer Society pretty much adopted their guidelines and produced a guideline. And what they recommend is that cancer survivors should follow the physical activity guidelines for Americans. So that 150 minutes per week of activity. They also published some specific adaptations related to which type of cancer you had and if you had any specific complications. So those would be important to look at. The bottom line message from these guidelines, as I've been telling you, is to avoid inactivity. Okay, so that's really important. So if the American College is recommending that Americans follow the American Physical Activity Guidelines, then we can recommend that the Canadians follow the Canadian guidelines, because they're pretty much the same, 150 minutes per week of moderate intensity aerobic activity. The guideline actually says moderate to vigorous, the Canadian guidelines, but the cancer guidelines focus on moderate. When you're going through treatment, it's actually not recommended that you engage in vigorous physical activity. Once your treatment is over and your immune system and everything is getting back to normal, then you could increase back up to a more intense level of physical activity. Both the cancer guidelines and the Canadian guidelines also recommended at least 2 days per week that you do some kind of strength exercises. So some small weights or some stretching bands. And it's often a good idea if you can go to an exercise class to learn how to do those exercises safely, etc. And for older adults, the Canadian guidelines also suggest that you should be doing some balance exercises. And that's to help with the issue of falls in older persons. And these guidelines are available online as well. There's just a one-pager that you can put on your fridge to remind you that you should be engaging in these activities. The other thing about the guidelines is it stresses that you don't have to do all the activity at once. You can break it down into 10-minute bouts. Okay? It's the additive effect of the activity over the week. Okay, so usually you say about 30 minutes a day, but you don't have to do it all at once. So particularly for cancer patients with fatigue, break it down. So here's how we distinguish between moderate and vigorous. So if you're doing moderate activity, you should be able to speak. You should be able to talk, have a conversation. So you're walking briskly, but you can talk to your partner that's walking with you. And again, cycling, you can notch it up so that's an intense activity, but as long as you're able to talk and you're breathing hard but you're not out of breath, then that would be considered moderate activity. The other thing to remember is that you don't have to do formal exercise to be engaging in physical activity. You can be doing housework, gardening, washing the car, those types of things. It's all a matter of getting your heart rate up a little bit and getting your breathing up a little bit, and that tells you that you're engaging in physical activity. Okay? So vigorous activity is when you're breathing so hard that you can get a few words out, but you can't talk. So we want you to avoid that during your treatment, and then again, once your treatment is over, gradually build back up to that level if that's your intent. So I mentioned that the cancer-specific guidelines had some adaptations or some precautions. So some of these might be common sense, but if a patient has anemia, they should delay getting back to an exercise program until they have the anemia treated. somebody with a compromised immune system. You'll probably be told to avoid public places, and so you wouldn't be going in a public swimming pool, etc. The other really important recommendation here is that severe fatigue. So someone who rates their fatigue as 7 to 10, they should still be trying to get in 10 minutes of light exercise daily. So light exercise, I would say that your breathing isn't higher. So instead of a brisk walk, you're going to go for a leisurely walk. Okay, but your blood is still pumping, and if you need a rest, that's fine. But at least 10 minutes of light exercise most days. Okay, you can give yourself one bad day, but you can't give yourself 7 bad days, because then you're going to start that downward spiral and you're going to have difficulty getting back to a routine. I mentioned comorbidities. So if you have lung or heart problems that might prevent you from being able to exercise, you need to talk to your physician or a physiotherapist to find out, to get a program that would be appropriate for your condition to get you back exercising. Some cancer treatments can cause peripheral neuropathy or weakness in limbs, and so some types of activity might not be appropriate. Activities where you need balance, so they recommend a stationary bike, so you're seated and you don't have to worry about falling off the treadmill because you've lost your balance. So those are just some of the precautions that you would find in that guideline. They also go through the different cancer sites and they give recommendations. So this is just one example for breast cancer related to lymphedema. So one reason why breast cancer patients sometimes are afraid to exercise is because they're afraid it will either cause lymphedema or make it worse. So that's the swelling that cancer patients that have had their lymph nodes manipulated or removed could develop. So research actually shows that exercise, progressive exercise, can prevent lymphedema in those at risk, and it can actually improve lymphedema. But again, you should get some advice about that before you start a program, and you may need to wear some compression garments on that limb to prevent the edema as well. So now I'm going to talk about self-management, and as I said, there's a number of self-management, but I'm going to focus on just a few items. So I'm going to focus on balancing your energy, and I'll talk first about assessing your fatigue, some strategies to balance your energy, and then you need to reassess. So I teach undergraduate nursing students, and my first thing I always tell them is a good nursing care begins with a good assessment. So if you're going to be managing your care, you need to do a good assessment. So we'll start off by having you monitor your fatigue intensity. And if you don't mind sharing, if you think about the past week, how many of you would rate your fatigue level as mild? So 0 to 3. Okay. So I think I'm at the top end of mild, but I'm in there. Okay, so how many of you would rate your fatigue over the last week as moderate? So 4 to 6. Okay. And how many of you would rate it as severe, 7 to 10? So we do have a few in that category. Okay. I can just throw this out there. Have you talked to someone about it? So how many of you have talked to someone about it? Okay, and what advice have you been given?
We don't know.
They don't know. Okay. So has anybody been told to exercise? Some of you. Okay. Okay, so that's why you're here, because nobody knows what to do.
We don't know.
Okay, well, let's see what we can do. So in addition to measuring the intensity of your fatigue, you should be looking at the quality of your fatigue, looking at the patterns. When did it start? How long does it last? Is there anything that makes it better or worse? And any symptoms that you're having along with it. So are you feeling sad? Are you feeling, is your memory having issues with that? So that when you do go to see a physician, you can give them a bigger picture of what's happening. So it's not just my fatigue is a 7, but I also have all these other issues that may be impacting it. And then also think about how that fatigue is affecting your functioning, okay? The next thing you want to do, and write some of that down so that you don't forget, because patients go to see a physician and they have 10 minutes and and then you go blank and you forget. So write it down or have someone else record it for you. The next thing I would want you to do is to track your fatigue for at least a week. So there's different ways you can do that. You can use a calendar on the wall, or you can create a chart. And if you're not shy or you're not afraid to share that information with your family, I would suggest putting it right on your fridge or somewhere that you frequent so that you can remember to fill it out. Or your daughter or your husband could actually notice the chart and ask you, Mom, how's your fatigue this morning? What did you do this morning? Or they might actually, well, she slept 3 hours this morning, and they can write that in for you. So keep it for about a week. If you're more of a private person and you don't want it on display for everybody that comes into the kitchen, get a journal or a notebook and just keep it somewhere that's handy so that you'll remember again to write in it. And then you're going to look at your week and look for some trends and patterns, see if there's anything apparent. I like charts, so if you come to my office, I have charts and lists for everything. And so I've broken it down into 7 days of the week, and morning, afternoon, and evening, because your fatigue level will change over the course of the day. And so you want to get a sense of whether or not your fatigue level is higher or lower at different times of the day. So you can start tracking your numbers. And typically most people will find their energy level decreases over the day, but some people might have a burst of energy later in the day. So you find out what your energy level is like and when your fatigue is. The other thing you can do is track your activity, because you want to see if there's a relationship between your activities and your fatigue. So write in if you went walking, if you had appointments, things that got you out of the house. If sleep is a problem for you, you might actually record how many hours you're sleeping every night. If you're napping during the day, it's a good idea to also record how long you're napping. So put that all in and get a picture of what your week is like. And as well, if you're having other symptoms or mood issues, you can track those as well. Okay, because then you can see the relationship between everything that's going on. And it'll give you more information to take to your physician when you go to talk about your fatigue. So if you're finding that you're depressed 6 days of the week, that's a problem, so you need to have that addressed. So look at your week. If your fatigue was mostly in the mild category, you can probably work on some self-management strategies. Mention the fatigue to your physician the next time you have a visit, and mention that you've got it under control and you're managing it. If your fatigue is moderate or severe, then you do need to see a health professional and talk to them about your fatigue. You can still work on some self-management strategies on the side, okay? And certainly start them while you're waiting to get an appointment if there's a time lag between when you've done this and when you get your appointment. And if your fatigue is severe, then you want to try to get an appointment as quickly as you can to see if maybe they can help you manage some of those other issues and get your fatigue under control. Okay, so I know talking to a healthcare provider can be frustrating at some times, but remember, I mean, they are not specialists on cancers. They have to know about lots of different things, so we need to give them some time to learn how to do these things. So you can educate them as well too. If you know about a resource, then you tell your physician about how great it was and how helpful it was, and that no, I don't have to just live with it. Okay, so energy balance. Activity and rest. If you have too much activity, you're going to tip the scales. If you have too much rest, you're going to tip the scales. So you need to find a balance. So the first rule is you have to be active. So inactivity is going to hurt you in the long run. Okay? So how are you going to be active? So you do not want to stay in bed. Okay? So bed is for sleeping. You want to get out of bed every morning, even if you're going to be sitting in a chair, trying to move around a little bit, and think about how you're going to reintroduce some physical activity into your life if you've stopped. And so you want to start low and go slow. So starting low starts with your assessment. So you tracked your fatigue and your activity for a week. If you found you were able to walk for 10 minutes, start with that 10 minutes. And then you're going to gradually increase as you're able to. If you found you were able to do more than that, 20 minutes or swimming for 20 minutes, you can start there. Okay? So everybody is different. Everybody's starting at a different point. So most days you want to have some physical activity, and at least in bouts of 10 minutes. So commit yourself to doing 10 minutes. If you're feeling really good at the end of the 10 minutes, you might add a little bit more. If you've had enough, at least you've done your 10 minutes, and then you can have your rest. Try to include some strength exercises at least 2 days per week. Okay. Focus on getting that 10 minutes of aerobic activity first, but if you can handle a couple days of a little bit of resistance training, that'll be helpful. And as I said, commit to that 10 minutes per day. Okay? You can give yourself a day off if you're really having a bad day, but don't give yourself too many days off. So what are some motivators to be active? So obviously, if you don't like walking or you don't like swimming, then don't choose those activities. You have to choose something that you enjoy going to, okay? And mix it up. So don't walk every day. Walking is often proposed because it's easy and most people can do it, but if it's really boring, then you're going to tire of it. The other thing is if walking is a little boring, listen to some music. Find some nice relaxing music or some music that pumps up your energy, whatever is your style. Or take a walk in nature. So now you're combining the physical activity with a nice stress reduction. So nature, listening to the birds, listening to the water at the beach also helps you reduce your stress. So another factor to help improve your sleep. Do some activities with friends and family. So doing something on your own might be a little boring, but if you're doing it with your family members, that might make it a little bit more fun. And as well, group activities. There is research that shows with cancer patients in particular that when they exercise in a group activity, they're more likely to adhere to the activity. And it's partly because of that safety aspect. So if they're going to a class that's led by someone that knows about cancer, they're going to feel a little safer doing the activity. As well, if they're exercising with other cancer survivors, they might feel a little less embarrassed if they have to stop halfway through and take a break, because they know everybody else in the room also is going through what they're going through. Okay, so you want to be active, but at the same time you need to conserve your energy. You need to conserve it for the things you really need to do and want to do. Conserve it so that you are able to do some physical activity. So the 3 ways you can do that are to plan, prioritize, and pace. The 3 Ps. Some of the literature will say 4 Ps or 5 Ps. I like to simplify it to 3 Ps. So you've tracked your activity and your fatigue levels. So now you want to plan your activities when your energy is the highest, and you want to rest when your fatigue is the highest. Okay, so plan that ahead of time and see how that goes. But be realistic. Okay, you're not going to conquer the world in the first week. So look at what you did in the week that you tracked, and try to do the same amount of activity, but plan it ahead of time, and then as you go, you can try to increase, okay? So put in that 10 minutes of activity every day, unless you're starting at a higher level. So someone that was an athlete before they had their cancer, they might be starting at a higher level, and they might be able to do the 30 minutes every day. So you can use the same chart, you can use a calendar, you can use your journal, but put in your activity plan for the week. So put in the things that you have to go to, like your chemo treatment, and then something that you really want to do, like go to your son's hockey game or something like that. So I call that prioritizing your need to do and your want to do. Okay? So every week there will be some things you need to do, and maybe you're not realistic and somebody can say, no, you don't need to do that, somebody else can do that, but try to be really realistic about what you really need to do and what you really want to do for that week. You should be able to delegate some tasks when possible, so you don't have to do it all. If you can afford to pay someone to do some activities like cleaning your house, or you might choose to use your cleaning your house as your physical activity. So it just depends on what you'd rather do and what you can afford. And you can postpone non-essential activities. So your spring cleaning, you know what, if you don't do a good spring cleaning this year, it's still going to be there in the fall. You can do a fall cleaning or a spring cleaning the next year. And then you want to pace your activity. So make sure you plan some rest before and after your activities. Rest does not mean sleeping, okay? Rest just means sitting quietly so that your mind is not engaged in a whole bunch of things, maybe listening to some music, getting your heart rate down back to normal, okay? So before and after your activities. If you have a big job to do, break it down into smaller parts and tackle them in 10-minute bouts and have a little rest in between. So if you want to go for a big walk around the conservation area, there's always nice benches. So plan your route and have a break every 10 minutes, sit on the bench, enjoy the view. When you're feeling ready to go again, get up and do the next 10 minutes. Do one activity at a time. Now is not the time for multitasking, okay? Focus on one thing that you need to do, have your rest. Try not to rush yourself, give yourself enough time to accomplish the task, because you may find it's taking you longer to do something than it used to, and that's okay. And as I said, resting does not mean sleeping. Okay. So the other two P's that you'll sometimes see are posture and positioning, but I think that's actually part of pacing. So if you use good posture, it actually uses up less energy. And so if you're sitting up in a chair, it's actually a good idea to have armrests, etc. So again, depending on what your energy level is, but people with really severe fatigue, this is going to be even more important. And positioning. So if you're doing cutting up vegetables for dinner, you don't need to stand at the counter. You can sit at the kitchen table and do that job. And that's going to take less energy from you. If your fatigue is severe, you might want to have a walking aid. And you can get one of those walkers that has a little seat. So if you want to go to the mall and you get tired, you can have a little rest right on your own private little seat, okay, or wherever you're going. And the third part of conserving energy is to improve your sleep. So I said that you need to get out of bed in the morning. You want to stay out of bed except for when you're sleeping, okay? And you don't want to be using your computer in your bed. You don't want to have your TV on in your bed. Your bed is for sleeping. Your other activities elsewhere. So you should be getting up and moving around, sitting up in a chair during the day as much as possible. The other tip that can help is to follow a bedtime routine. So that involves two things. The first thing is going to bed and getting up at the same time every day as much as possible. Because then your body falls into a routine and it knows it's time to go to sleep and it knows it's time to get to wake. So that might take you a week or two to try to establish a routine, but it's very helpful. The other part of your bedtime routine is things that help you to unwind and shut down so that your body knows it's time to go to bed. So those are things like turning off the TV and the computer, maybe reading a book, listening to some music, having a warm bath. Not a hot bath, because a hot bath actually can be more stimulating, but a warm bath, helping you to relax. And you know, some people will drink warm milk or some herbal tea to help them relax. Okay? Don't drink too much, because then you'll have to get up to go to the bathroom in the middle of the night, which is going to interfere. But something that, and if you have that routine and your body gets used to it, it's like children. You read them a bedtime story and then they know they have to go to sleep. So, and you can have a bedtime story too, that's fine. And the other important thing is to limit your naps. So it is suggested that 1 nap per day in the early, yeah, you're laughing, but nighttime is the time for sleeping. So in the day, you should have 1 nap per day if you need one, less than an hour long. And it should be early afternoon, because the later you have your nap, the more it will interfere with your nighttime sleep. Okay? So have a look at your pattern, see how much you're napping, and then find a plan to start cutting back on that napping. So obviously you also want to avoid stimulants in the late afternoon and evening. So that's anything with caffeine. And everybody has different caffeine tolerances, and you probably know that, but you know, it's okay to have a coffee in the morning, but afternoon and evening you should avoid it. And as well, your exercise. If you exercise too late, that can also keep you awake. So it's nice to have a walk after dinner, but Try to have it early evening if you need to, and maybe a lower paced activity if you're going to, and your more moderate activities earlier in the day. The other thing to look at where you're sleeping, it should be a cool, dark place, okay, and quiet. And so, you know, if there's, yes, I know, but the best you can do, right? Or maybe you need some earplugs or something, or some white noise. Does anybody use a white noise machine? I don't have a white noise machine, but sometimes I'll put the fan on in the bathroom, and it kind of does the same thing. And it's on a timer for 30 minutes, and it goes off. So you can try that, and that will sometimes cut out noise from other rooms, because I go to bed before my kids do too. My kids are grown, but yeah, they're still up. So. And the dark is important too, because again, your brain, the darkness, again, tells it to sleep. So if there's light coming in, you need to get some blinders. Some people sleep with blindfolds. I'm not comfortable with that, but if you like that, you can do that as well. Sometimes, no matter what you do, you can't fall asleep, or you wake up in the middle of the night and you can't sleep. If you stay in bed and you're awake for another 15 minutes, it's probably a good idea to get up, maybe do your bedtime routine again, maybe not the warm bath, but maybe a warm drink or some music or reading. Reading will make most people sleepy. Try that, and then go back to bed, and hopefully you'll be able to fall asleep at that point. Okay, so you've assessed your fatigue, you've planned your activities, you've gone through this a few weeks, so you need to reassess how you're doing. You can use the same chart again. You can actually take your planning chart and see, well, did I do what I said I was going to do? Yeah, I did my walk. Wednesday, no, I wasn't able to walk. I slept all morning. So, and then it'll give you a sense of how you're doing and what you might need to modify the following week. And you don't necessarily have to do this every week, but certainly in the beginning, it might be helpful to you and to replan for each week. So adjust your plan based on how you did, and try to fall into a routine. So that bedtime routine, the physical activity routine, and then reassess maybe on a weekly or a monthly basis to see if there's another pattern. And so this lady was mentioning that every 4 weeks, she was crashing. So again, looking for trends over time that you might not see in a week period. And as I said, be kind to yourself, be realistic, adjust your plan, okay? And I want to mention caregiver fatigue, because caregivers get tired too. Family members are taking on added responsibilities. They're also experiencing the worry and emotional distress that the cancer patients are going through. Healthcare providers, we also empathize with our patients and take on a lot as well. And so we can use these same strategies as caregivers. Okay, you might not need to track your fatigue, but exercise and sleep is something that a lot of us are not getting enough of. And that being said, it's recommended that you sleep for about 7 to 9 hours per night. If you sleep too little or too much, it's not good. Okay, so aim for about 8 hours a night, and not more than that. And make sure your caregivers are also looking after themselves. Okay, it's like when you're on the airplane and the flight attendant says that when the oxygen mask drops, you put it on yourself before you help the person beside you. So the caregiver has to take care of themselves so they're available and strong to help their family members, and healthcare providers as well. So this is a little summary of the take-home messages. There are other strategies out there that are also helpful, but I think if you start with these, assessing your fatigue, if you're a 4 or higher, you should have an assessment by a physician or nurse practitioner to see if there's anything that they can help you with, or they can make referrals and advocate for yourself. Maybe bring a family member with you to help you with that advocating. And then work on balancing your energy. So based on your assessment, look at where you can increase your physical activity, look at where you can improve your sleep, look at where you can conserve your energy. And hopefully some of those strategies will be helpful to you. And hopefully you'll be able to take be able to access some resources. So I looked online for some resources. One of the best ones that actually outlines a lot of what I've talked about is available free online from the Canadian Partnership Against Cancer, and so you can download it from online, and it talks about being active, managing stress and emotions, finding support, okay, support groups, conserving your energy, eating well. I didn't talk about nutrition, but I think there was already a presentation here on nutrition that you could actually go on the website if you did not attend and watch that nutrition, because you need nutrition to have energy. So that was one resource. The Canadian Cancer Society has a number of publications. They don't seem to have one specifically on fatigue, although they do have one called Life After Cancer Treatment, which mentions fatigue a little bit. They also have one about complementary therapies that talks about a lot of those mind-body interventions that you might be interested in exploring. You can also check out the American Cancer Society website. They also have additional resources. This is an old publication that I had in my binder that I got at the Cancer Center in Kingston years ago. It's called Your Bank to Energy Savings. And this is the booklet that has a lot of really practical tips on conserving energy. So there's bathing, grooming, dressing. So if you're in that severe fatigue category, this is a booklet that's helpful. Now, unfortunately, I tried to get some copies before I came down here, and there is a phone number that you can call, but nobody called me back. Okay, so I just wanted to acknowledge my funders that have been funding my research, in particular the D'Souza Institute that's funding my PhD work. Yeah, so my email, if you have suggestions for me or questions, certainly feel free to email me. Because when I'm finished my PhD, then I need to do my next stage of research, and so you're the best people to tell me what I should do next or how I can approach it.